Welcome back. So we're going to talk about the pharynx, esophagus, and maybe even the stomach in this video. So the pharynx itself is the throat. So it's the tube that runs from the back of the oral cavity. It actually has three sections. It has a nasopharynx, an oropharynx, and then a laryngopharynx. The two regions that we talk about or discuss in the digestive system is the oropharynx and the laryngopharynx. And this leads us to the esophagus. The pharynx is composed of stratified squamous epithelium. It is non-keratinized, and its function is to protect us. There we go. Then we move into the esophagus. The esophagus is a long tube. So it runs from the pharynx, and the pharynx ends right at the region where the larynx is. So this cricoid cartilage here, that's where the esophagus starts. And it runs all the way down through the entire thoracic cavity into it moves through the diaphragm into the abdominal cavity and links to the stomach. We have an upper esophageal sphincter that controls the movement of food going into the esophagus, and a lower esophageal sphincter that controls the movement of food into the stomach. This is also composed of stratified squamous epithelium, non-keratinized for protection, and the esophagus itself is anterior, the vertebral canal, and posterior, the trachea. So when food moves into the esophagus, it actually moves, so the trachea is here, and the the bolus will actually cause the esophagus, the smooth muscle, to expand into the region of the trachea. And this is why you cannot breathe and eat at the same time. The esophagus is covered or surrounded by a mucous membrane that helps material move easily through. And food moves in peristaltic motions. So the term peristalsis means or is a mechanism for moving materials from one region to the next region. It's kind of like squeezing a toothpaste container, and so I'm going to show you the picture. Oh, hold on. I'm going to go. Here you go. It's like squeezing a toothpaste container. And so food moves down through the pharynx into the esophagus, and the smooth muscle squeezes in one area, pushing the bolus down, and then it starts to squeeze in the next area, pushing the bolus further. So it's kind of like when you're squeezing toothpaste from the bottom of the tube towards the top of the tube so that you can get the toothpaste out of the container. And that's peristaltic waves or motion. So food moves from the oral cavity into the pharynx and then into the esophagus in a process known as deglutination or swallowing. And so we have this soft food bolus, this tiny ball of food and mucus that are made in the mouth. And the original or the initial phase is the oral phase, and the oral phase actually is a voluntary phase. So we push the food to the back of the mouth to swallow it. From there, we move into two involuntary phases. The first involuntary phase is the pharyngeal phase. So once the food hits the pharynx, it's no longer under our control. And then food moves from the pharynx into the esophagus, and then we're in the esophageal phase. And food is moving continuously through those peristaltic waves, which I talked about. And interesting, I always like to bring up past experiences, and so I'm sure that this has probably happened to many people. If you ever had a piece of gum or a piece of candy that you were sucking on or chewing, and it went to the back of your mouth, by the back of your tongue, and slipped into your throat. So if it hits that pharynx, it stimulates that involuntary phase known as the pharyngeal phase, and the food goes down. And that's why sometimes when you're chewing on like gum, if it goes to the back of the mouth, it'll end up stimulating you to swallow that gum before you're ready to get rid of the gum. And we talked about this. I'm going to go to the next slide. So some disorders associated with the esophagus. The first one is heartburn or reflux esophagitis. This is basically inflammation of the esophagus. So when you hear the term heartburn, we're talking about the esophagus receiving gastric juice from the stomach. So we have that lower esophageal sphincter that stays closed, and that's important. If it was opened, then the gastric juice in the stomach could move into the esophagus and cause damage to the tissues there. So the stomach lining is made for this gastric juice, so we have a lot of protections lining the stomach, but the esophagus is not made for this gastric juice, this low pH juice, okay? So if it hits the esophagus, it's going to burn the epithelium of the esophagus. So this is typically seen, and most of us have suffered from bouts of heartburn. Typically it's seen in individuals if you've eaten a really large meal, if you're pregnant, if you're overweight, and I guess if you smoke. So if you have a hiatal hernia, that also can stimulate gastric reflux, reflux esophagitis. Okay, so typically the treatment is going to be most people will take Tums or some type of something to decrease the acidity, anti-acid medicine. You might take, I don't know, that pink bismuth or whatever. Other people will use milk or something that is more alkaline, which also can help. Elevating your head, so not laying flat, will help. And then, of course, eating smaller meals, lowering your weight, stop smoking if that's why you're having heartburn, would be other treatments. A more serious disease that many of us have not suffered is gastroesophageal reflux disease, or GERD. So GERD is the result of chronic heartburn or chronic reflux esophagitis. So when you have heartburn 5 times a week, like 4 to 5 times a week, this can be a sign that you actually suffer from this disease. And the problem with GERD is you're constantly having the stomach acid move into the esophagus, and that can cause damage to the esophagus over time. So, I mean, it's obviously going to damage the tissue, but the tissue will fix itself if you have one bout of gastric reflux. But if you have multiple bouts in the same week, you can't fix the tissue fast enough, and so the tissue can actually start to form scar tissue. When you form scar tissue, it can actually lead to damage or problems with opening and closing of the lower esophageal sphincter. It can also, if the pH stays too low in the esophagus, it can actually lead to the formation of intestinal tissue in the esophagus, because intestinal tissue is more commonly used to getting that acidic material. So that would be like that pseudostratified columnar epithelium and simple columnar epithelium. And that would also lead to potential esophageal cancer. So treatment for this would be a lot of the things that you did for the gastric reflux, but they would also give you some type of a proton pump inhibitor that decreases the amount of hydrochloric acid produced in the stomach, so that you don't have so much acid all the time. The next region is the stomach itself. So the stomach is a large sac, and it is in the upper left quadrant. It is inferior to the diaphragm. Actually, the esophagus moves through the diaphragm to reach the stomach. And it is a storage area for food, and it's where food is chemically and mechanically digested. So we're constantly moving. Our stomach is constantly churning when food is in there. And the food sits in the stomach while the stomach is churning for about 2 to 6 hours. While that's happening, there are chemicals in the gastric juice that actually allow for the breakdown of proteins and even a little bit of fats. I'm going to stop here and actually talk about the stomach in our next lecture, because there's a lot on the stomach, and this has already been an 11-minute video, or almost a 12-minute video. So I'll talk to you in our next video. Okay? Bye.